Hi, so Jen Curran here from Wren and Greyhound, and absolutely delighted to be joined today by Shumela Ahmed, Managing Director of Resilience Learning Partnership. The reason we're doing this short video is because Shumela, you shared a story with me about 3 or 4 weeks ago now that literally gave me goosebumps, and I just thought it was an amazing story that had to be shared, and I think it'll be really relevant to a lot of people working in the sector right now. So thank you so much for your very precious time. I know you're very busy at the moment and we'll soon find out why. But maybe just to start off, could you just give us a wee bit of background, Shumela, to the Resilience Learning Partnership in your organisation?
Yeah, sure. So we are a training and education provider ultimately, but we have a dual purpose. Our first purpose is to provide training, education and development for staff across health, criminal justice, social care and education around trauma, lived experience and services, engagement with services in particular. How we do that is our second purpose, which is all of our trainers and educators have lived experience, as well as the relevant qualifications or professional experiences needed to fulfil such work. And where people don't have that skill set yet or the experience yet, then we will work with them in a project format so that they can feed directly into our work. But even going further than that, people who want to and who choose to, we will skill up and develop and get access to education opportunities so that they can come out and deliver work with us in the future.
Excellent, thank you very much. And I know you've been working on quite a big project in RLP, as we'll now call it, Resilience Learning Partnership, over the last year. Give us a wee bit of background to that because it feeds into your next part of your story.
Yeah. Well, last year we began a collaborative project with Community Justice Scotland, Clackmannanshire Council and ourselves, and the project had also a dual purpose. The first kind of phase of the project was identifying 2 groups of individuals, one who had experienced gender-based violence in the Clackmannanshire community and one who had experienced the criminal justice system, and there was actually a lot of overlap between both groups. We worked with those groups throughout the first phase in a training / education / developmental way to teach them about our work, what we were doing, teach them about a little bit about trauma, about services, and how trauma can impact how you engage with services, a little bit of psychoeducation, some education around and awareness around services and the people who work in those services and their roles, a lot around power, human rights, legislation that people don't often understand. And we worked with them for around 6 months. And the view was that then at the end of the 6 months, we would go into a space with Community Justice Scotland and create a series of action research workshops. And then a few weeks later, we would go and deliver those workshops to a group of professionals from the Clackmannanshire community who sit across those 4 key areas that we work in, so health, criminal justice, social care and education.
Fantastic. And I know your project was going great guns towards the beginning of this year, and then obviously the coronavirus situation happened, and like all organisations, like organisational leaders right across Scotland, the rest of the world, you suddenly had a situation in your hands. You were in uncharted territory. So what happened when that first happened?
Well, like many other people around the beginning of March, things just started disappearing at our diary. And as we're a small social enterprise, we kind of hand to mouth, as we work and we're paid for our work, that's what pays the people in our organisation. That's all we're kind of happy to do. So with the work disappearing, so did the income stream, and like a lot of other people as well, we went into panic mode. I went into panic mode. I am now calling it was a trauma response that I had. I was really fearful of losing everything that we'd worked so hard for over the past 2 years. And I was really worried about the people who we'd been engaging with on our Hard Edges project and where that was going to leave them, because we'd been building them up for 6-7 months to go and do this huge piece of work. And we were all just kind of hanging there.
And so it went very much like what you described there was that trauma response, that panic. And what you said to me a few weeks ago was what you decided to do with that panic. You decided to turn your panic around.
I decided to turn my trauma response, my panic, into ultimately thriving in the adversity that we were being presented with, and so did everyone else around me who's involved with RLP. So my colleague, who is my other half at the moment in RLP, and the people that were engaging on our project, they and myself, we kept in contact through Zoom actually, and having regular chats and stuff in the beginning. And actually in the beginning, we, like everyone else, I ran by my office and got a load of stuff to work on, to bring home to work on, and when I was doing that, I also grabbed a load of craft stuff to bring home for my son, which led to what is now effectively RLP's trauma response initiative, a COVID response initiative, a collaborative effort to try and do something during this just now, and it's given us a stream of work.
So you brought that stuff home so that your son had some craft materials and stuff to be able to use over this period. And I think, did you post that on social media then, that you had brought that home?
Yeah, I did. I came home and I put it all out nice because I was right proud of myself for going and getting it all. And the teacher in me took some photos and posted some pictures online saying school starts next week in this house. And what that then led to was a conversation that evening with a mum that we are currently engaging with, who'd said, I've seen your pictures on social media, they're brilliant, all that stuff looks great, I don't have anything like that in the house and I've not really got the money to run out and buy it just now either. And I was like, well, I'll put you a wee box together for your wee boy and drop it down. And as I was making that box up in my living room, I actually ran into the kitchen and screamed to my husband, this is what we could do, this is what we could do. And I thought, actually, if this person needs these items right now and can't get access to them, there are other mums out there, other parents out there who are in exactly the same situation. And I think that perhaps we could help.
So that's the story of the first box then. Just all coming from that one spark, that one idea that you had as you were making it up. So where are we now? From that one box, what happened after that?
Well, I had the idea, and just to make sure that I wasn't crazy and just coming up with this crazy notion that, you know, wasn't going to go anywhere, I spoke to our local TSI, Click Manager Third Sector Interface, to the chief exec there, and I told her about the idea. I told her I thought that there was a need, and did she know where I might be able to go to get some funding to get it off the ground. And she thought it was a great idea, and she said, we'll give you the funding. And she did very, very quickly. Within days, we had enough to get about 400 boxes off the ground straight away. And that's exactly what we done. We ordered enough for 250 just to test the water. Didn't want to go too overboard. And as I said, that we had been completely engaged with the people who had been engaging in our project, who wanted to stay engaged during lockdown. And myself and my other colleague, we were all in constant contact. And so I took it to them and I said, what do you guys think? And they were totally up for it. And so we ordered the 250 boxes worth of stuff and got it delivered individually to each of our houses, you know, 50 lots of everything to everybody. And that was us. We started the first 250 boxes and started getting them out.
Amazing. So what happened next after that? What happened after the first 250, Shumela?
Once we got to about maybe 50, 60 boxes left, we all came together again and made the executive decision that it was time we moved out of our houses, because it was taking over our homes. And we thought, we should go back down to our base, which was still open. It's a huge office building and it was still in operation, albeit at a reduced timetable. And everyone was comfortable with that. We got PPE as well. And from the beginning of the second week, we were down in our base, and we had a proper production line set up because it's really, really huge. We were able to borrow a space in the building that's just lying empty, and that's where we are now.
Amazing. So I think from memory, I think you were telling me that people started getting in touch. So individuals and organisations from there started getting in touch and find out how they could get a box.
Yeah. So we first initially put out a message on Facebook for the first lot of boxes, and we got over 350 individual requests from people who were requesting one or more boxes. But a few days as well after it going on social media, we had organisations contact us as well. So we had partners in advocacy contact us and very kindly donate enough for 50 boxes and not really care where those boxes went, apart from maybe a request for a couple of people that were quite nearby to us that we could get a box or two out to. And that was fantastic, because what that allowed was us to get some boxes outside of the Clackmannanshire area. And then we actually had organisations coming to us very quickly, again asking to purchase the boxes for their clients. So we had a big housing association, Sanctuary Housing Association, ask us to do enough for 100 boxes for their tenants. They thought it would be a nice way to reach out to their tenants right now, because most of the staff are furloughed and housing officers aren't around at all really for people. So that was one. Then we gave a load of boxes to organisations in our area, because us getting them all to people was becoming quite a lot of work. So it was easier just to give them to organisations and let them get them to people in batches of 30 and 40. And we done that with a big organisation called Home Start, but they're in individual local authority areas. So we gave the ones to Clacks for free, of course, but that then prompted another Home Start to get in touch with us in Renfrewshire and Inverclyde to say we'd like to buy some for our clients, and they did. Home Start's an amazing organisation. It works with young mums who have children and who are maybe struggling in the house on their own, and it's usually older women who can give a lot of good advice and mentor really. So we've been really, really happy to get loads of boxes to them. Yeah, that's a really growing trend with organisations at the moment, getting the boxes to them.
Right, brilliant. So from box one, how many boxes have you now sent out to families?
Well, people are delivering Saturday and Sunday this week, very graciously, and by the end of the day on Sunday there'll have been 1,000 boxes given out. Probably a bit more, but I'll need to do a count next week. Definitely 1,000.
Wow,
1,000.
Unbelievable.
I've just ordered the stuff, the boxes anyway, this week for another 1,000.
Oh, wow, unbelievable. And as you started doing this work, what you said, what you've told me is that you became aware that maybe there's other people that could benefit. So your head was already beginning to think about how else could we adapt this idea. So tell me a wee bit about what the plans are for some of that.
Well, some of those plans have started already, actually. We realised a few weeks in that maybe the craft boxes weren't for all children and young people. So we quickly set about designing a self-care survival box, we're calling it. And that's for teenagers and older young people. It has a lot of nice self-care stuff in there, like toiletries and sanitary products, razors, shampoo, bubble bath, those kinds of things. And then it has craft items too, and some art stuff that's more for older people. So we just started, we started production of 350 of them a couple of weeks ago. We had a hold up on a couple of items, and I think about 60 or 70 have gone out already, but we've got about 110 sitting in the office waiting to be picked up today, tomorrow and over the weekend. So it's fantastic.
Wow. And then there was another couple of ideas you had as well.
And they will be starting in the next couple of weeks. We're just still deciding what's going to go into them, but we will be doing boxes for OAPs who are shielding in Clackmannanshire, and we're doing suicide prevention boxes we're calling them. And we debated changing the name because some people weren't comfortable, but that's because nobody's really comfortable talking about suicide. So I actually think it's really important to have the name in there. So we're going to keep it. And that's actually in memory of someone that my family knew, that my husband, a friend of my husband's actually, who passed away. So we're getting them to men and women under the age of 45 in single occupancy households across Clackmannanshire. And with the OAP and the suicide prevention boxes, we won't have the same numbers as we're doing with the craft and the self-care boxes, but maybe a couple of hundred of each we'll be doing. But they've got cool stuff going on them, like seedling plants for tomatoes, stuff like that. And we're talking to some of the retailers to see if they would be willing to donate as well for them. So we'll see. Watch this space.
Fantastic, Shumela. Quite unbelievable. And then I think, you know, the other part of the story that when you shared it with me, that was really quite amazing was just some of the kind of unanticipated outcomes that have came about as part of delivering these boxes. Do you want to tell us a wee bit about just the impact that the boxes have had, I suppose, in the lives of the people you've been giving them to, but also in terms of your volunteers and your team?
Yeah. Well, you know, the initial point was to get boxes out to parents and children that had that need. And okay, the kids are getting their boxes, parents are getting a bit of relief from that. But the volunteers has been one of the most significant things for us. So many of the volunteers who are out delivering boxes are getting them, are furloughed, they're furloughed from work at the moment. A lot of them are professionals. And what they're getting out of this was something I had never expected. And we've been delivering ourselves, and what that mechanism has allowed is for us to be speaking to the people that we're delivering them to. And because we're all about services and service improvement, that's what we're talking to people about. And we're finding out that people are needing access to lots of other service provision during lockdown, but actually not just because of lockdown. They were needing it anyway, but perhaps they weren't connected enough within the community to know that, or to the local authority, or the third sector, and that's completely understandable. So we've got a lot of people access to money, to other resources like devices and stuff like that through other charities or third sector organisations, and the council as well have been really great at stepping up and getting people access to certain things. And then the people who are delivering the boxes are volunteers that are very new to our organisation. We've just met them during COVID. But the people who are actually making the boxes are people who were engaging on our Hard Edges project that we were talking about earlier. The people who chose to stay engaged through the Zoom calls and stay connected, they are the people who are making the boxes. And excuse me, although they were volunteers in the beginning and they were volunteering their time, we've now managed to source funding to have 4 of them employed 12 hours a week to do this. And might I add that they're also getting the Level 6 Community Achievement Award for doing what they've been doing, which is absolutely fantastic. So they'll have a qualification, a Level 6 qualification at the end of this.
Phenomenal. And I think you spoke a wee bit about just how this has turned into a bit of a circular economy. I think you described it as well. What's happening there?
Yeah, so amazingly, just off the back of us delivering the boxes, we had a few different people contact us and say, we've got old baby clothes here, or baby items, or children's clothes, and there was a child's bed, a lovely big pink bed, princess bed as well, that someone didn't need anymore. And when they were clearing it out, we were the first people that they thought of, because they got a box and they remembered that, and they kind of got to chat to us and got to know us and know what we're all about. And so they thought, we'll contact them and see if they would like this stuff, and call it the universe or whatever you want to call it. At the time when that happened, I was talking to the Refugee Council in Glasgow, who had heard about what we're doing on social media and had contacted us to see if we could send any boxes their way, and I was really, really keen to try and make that happen, because at the beginning of this we committed to ensuring that a portion of what we were doing would go to BAME groups, because there was a lot of talk at the time around those particular groups not getting the same access as other groups were around extra resources and provision that was around in the UK. So there was a bit of a public campaign about that on Twitter, and I kind of publicly committed to make sure that when we were doing this, a portion went. So it was a good way for us to get a load and know that they were going to the right place. And that meant that we were able to give all of those baby items in particular, because there's a lot of women who are pregnant, who have just come into the country and don't have any resources at all. So we were able to take baby baths, nappies and food, baby food and everything, as well as lots of gorgeous baby clothes. And we still got loads sitting, waiting to do that again. But again, we want to make sure they're going where they need to be going.
Amazing, Shumela, absolutely amazing. And I know you've got some plans of what might happen next with this. You might not be able to share them yet, so watch this space, but you've got some ideas of where this work might go next.
Yeah, definitely. We will be announcing very soon, hopefully, another item that we will be providing for people. They will initially go in the boxes. We're going to have 2,000 of these items, so they'll go in the first 1,000 boxes, but then we're going to do something on the side as well, a bit of a public health campaign, to make sure people are getting access to the things that they need to safely socially distance, and be able to abide by the guidelines that the government are setting out. That can't not be happening because people don't have access to the resources that you need to be able to do that safely. So if we can provide some of those resources, that's what we're going to do.
Fantastic, Shumela. Thank you very much for your time today, and thank you so much for sharing the story. I know it will give other people goosebumps probably. Thank you very much for taking the time to talk to us today, Shumela, and can't wait to see what's next for your project. Thank you so much.
Thank you.